Hello, it's great to be here at Embrace Life with Renai. I am so thrilled and so delighted to welcome Lourdes Health System as a sponsor of this show and thank them for their amazing support of my project here on WMCN. Today's show is dedicated to Lourdes Health System and its incredible team of doctors, health practitioners, administrators, and staff who tirelessly serve the community with the most advanced personal care imaginable. I am so proud to have you on board. Up first, with all the advances in modern medicine and breast cancer research, breast cancer diagnosis is no longer a fatal blow. Dr. Kathleen Greatrex is the chair of Radiology and Nuclear Medicine at Lourdes and can speak to us today about diagnosis, treatment options, and the latest diagnostic technologies. Welcome, Dr. Greatrex.
Hi, nice to be here.
It's so good to have you on the show. And you know, we talk a lot about the diagnosis of breast cancer. What's the first thing that you need to do when you hear that diagnosis?
You know, it's probably the most difficult diagnosis that you'll hear when you hear that you have cancer. And fear. You know, patients are immediately frightened.
Exactly.
And I think that what we have to do as practitioners, the ones that give them the news, be kind and be gentle. Because not only are you giving them the diagnosis, but you're giving that diagnosis to everyone that loves that person. So you must take that into consideration. I think the most important thing to remember with breast cancer is that 2.8 million women in this country are surviving this disease. It's not a death sentence, it's just a word. And they have to remember that. That even though they have that diagnosis, it doesn't mean that they're going to pass away from it. With the advances that we have today, the early diagnosis chances that we have today through mammography and screening, that breast cancer can be gotten at a stage when it can be cured. So these are the things that we must emphasize to the patients that we have. Be positive, always be positive, because there's always hope.
And it's so important to surround yourself with positive people too. Like you said, it's not just a diagnosis for the patient, for the individual, but also for the family. So it's not about, oh, you have this, it's about, you know, we're going to beat this thing together.
Absolutely.
And we're going to beat this thing.
I think that it's important to be positive with people, especially when you're dealing with this, because, you know, the breast is a part of our body as a woman, but it's also a part of our body that really not only performs the, you know, the ultimate thing of producing milk for our newborn children, but also it's a part of being a woman. So the diagnosis is a difficult one, emotionally, physically.
So what is, after they receive the diagnosis, does it depend on the stage, the action that's taken?
Yes, it does, very much so.
Can you explain that a little bit?
Well, there's three things that you really got to think about. First, you have to think about the size of the tumor. That plays into the stage. You have to think about whether it's an invasive tumor or a non-invasive tumor. That also plays a role. And also whether there's involvement of any of the lymph nodes. The lymph nodes are those areas, they are located all over our body, these lymph nodes, and they're actually filters of the blood. In particular, the lymph nodes are located underneath of this area, the armpit or the axilla, that drain the breast, drain the flow coming from the breast, and they catch these tumor cells. Well, during the course of surgery, these lymph nodes are tested, and we test them because that's a very important prognostic indicator, are the number of lymph nodes that are involved with tumor. Usually, the greater the number of lymph nodes, the higher the stage of the cancer.
And then it depends on the stage of the cancer, the kind of action that you take.
That's exactly correct.
In terms of biopsy and that sort of thing.
That's exactly correct. Based on this stage, you know, of course, surgery is the first form of defense, but then we have to think about other things that are utilized: radiation therapy, chemotherapy, hormones play an important role in these tumors as well. The receptors on these cells Estrogen, progesterone receptors are really important.
And you as the physician will be able to educate the patient as to their prognosis.
It's a team approach, Renee. You know, it's not just the radiologist. We do the initial diagnosis. We look at the mammogram, we look at the ultrasound or the MRI. We do the biopsies using a needle technique. We get the tissue goes to pathology, and they do the necessary stains, the necessary receptor analysis of the tumor, and then they can deduce a little bit more as to what type of surgery the patient's going to need. Then the surgeon comes in. The surgeon does the surgery. Based on what he finds, based on what happens there, whether there's lymph node involvement, whether there isn't, whether there's involvement of the chest wall or other areas around the breast, this is really important. So the surgeon plays a role there.
And we'll talk a little bit more about the next steps when we come back.
Okay.
More with Dr. Greatrex when we return. We are back with Embrace Life, and instead of just embracing life with me, today we are embracing life with Lourdes Health System. Dr. Kathleen Greatrex from Lourdes is here talking about breast health and breast cancer. And we were talking a little bit during the break about dense breasts. Can you talk to me a little bit about what that means and how that's different than other types of breasts?
Sure, absolutely. You know, New Jersey just passed a law that radiologists in their reports must put in there the knowledge about the density of the breast tissue on the mammogram. How dense is the breast tissue? What they found is that those women that have dense breasts have a 3 to 4 times likelihood of getting breast cancer. That's really important. Looking at a mammogram when the tissue is very dense is like looking through a snowstorm. It's really difficult to see masses. It's difficult to see calcifications. So we have to find other ways to evaluate these women so that we don't miss something.
Right.
So what we're advocating now is the use of ultrasound. Ultrasound can pick up about 27% more cancers if we didn't use it.
Actually, that was one of my questions. I was thinking about the idea of the ultrasound. Why is it that you do the mammogram before the ultrasound and only the ultrasound if something is wrong? Why does that, what is the order there? Why is that important?
Well, the important thing is that the ultrasound is going to pick up whether an area of abnormality seen on the mammogram is either going to be solid or cystic. If what we see is a cyst, and it fulfills the criteria of a cyst, we leave it alone unless the patient complains of pain. If we see a solid mass, then we have to go on further to find out exactly what that is. So the beauty about ultrasound and what's different about that from mammography is that it can help distinguish between a cystic area and a solid area.
Okay,
Now,
I
are
see.
cysts a bad thing? No.
Because they could be benign,
70% of all women,
not cancerous.
70% have fibrocystic changes of the breast.
Okay.
If you were in the mall and you looked at 10 women, 7 out of 10 of them will have these fibrocystic changes. That does not mean that it is a premalignant condition. All it means is that your body is responding to estrogen and progesterone. Now, if you're feeling these lumpy bumpies and they're not changing with your menstrual periods, in other words, they are staying the same or they're getting larger over time, that's when you should see your physician. But when you notice these areas in your breast that wax and wane every month with your menstrual cycle, that's very, very normal, not unusual. We see it all the time.
That's good information. And we cannot leave this segment, and we'll talk a little bit more in detail next segment, without talking about the importance of a mammogram.
It's everything. It really is. A screening mammogram is everything. And no other screening tool has been as successful in picking up lesions at a stage when we can treat it and we can cure it.
And it's not just important to have the self-exam. You have to have the mammogram.
You really need to have the mammogram because the mammogram is going to pick up things that a breast examination won't. Radiation dose is very, very small. You know, it's a little bit uncomfortable for some women, maybe not for others. I always recommend my patients come in the week after your menstrual period ends. That's the best time to come.
When your
because
breasts aren't as tender.
they're the most quiescent. If you're postmenopausal, go the first Sunday, you know, or pick your birthday, or do your exam. Pick your birthday, in other words, for your mammogram. But for your breast exam, do it the first Sunday, you know, of the month, or whatever you should do every month to make sure that you remember to do it.
Well, I just want to thank you so much for taking the time out of your hectic, busy, important schedule to come and be on the show to help women and men embrace life. It's been an absolute pleasure to have you, and I thank you for all your wisdom and your information. And we want to dedicate this show not only to Lourdes Health System, but also to your mother.
Oh, thank you.
Yeah.
Thank you. I lost my mother when I was a medical student at Temple, and she passed away at the age of 56 from breast cancer.
So she's smiling right now.
Yeah, I'm one of the people that have been touched by it, but we've survived it. My family has, and God bless me with this great work that I do at Lourdes.
Thank you so much for being with us, Dr. Greatrex.
Thank you so much.
Now that we have talked about the diagnosis, treatment options, and latest diagnostic technology, let's talk about how to take care of our breasts and possibly prevent health cancer, if there is a possibility for that. Nurse Navigator Christina Hunter will be here when we come back. Embrace Life with Renai is back, and we are dedicating this half hour of programming to our brand new sponsor, Lourdes Health System. Our next guest is also from Lourdes. Her name is Christina Hunter, and she is a nurse navigator. She's here to teach us a little about breast cancer screenings, life after breast cancer, and breast cancer prevention. Welcome, Christina.
Thank you. Thank you very much for having me.
Oh, it's a pleasure to have you on the show. So what does a nurse navigator do for patients?
As a nurse navigator, I actually get the opportunity to walk patients through their journey with cancer.
Okay.
So at the time that they're diagnosed, especially at Lourdes, I'm their first contact, where I actually will reach out to the patient when they're diagnosed. I explain to them what's going on, because initially once they hear they have cancer, that's all they hear.
Right.
So I sort of become their go-to person when they have questions, or maybe they forgot something that we had already reviewed. I set up all their appointments with the oncologist, the radiation oncologist, the surgeon, any special testing that they may need, any scans. I can help them and their family with that, because it's not just the patient's diagnosis, it's the family's diagnosis.
Exactly, like Dr. Greatrex had mentioned earlier. And it's so nice to know that you exist, that there's someone who is a health professional who can kind of take the patient by the hand and walk them through that, what could be a very traumatic process.
Oh, absolutely. And also making sure that the patient is being treated in a timely fashion and not getting lost to follow up or making appointments, not sure where to go next. And I'm actually there to make sure that they get to the places they need to go and they're being treated promptly.
So what is the answer to the question, can cancer be prevented?
It's not an absolute. There's things that we can do to reduce our risk of developing cancer, any types of cancer. One of the number one cause of cancer, which most people are surprised, it's diet. In a country where we do tend to be overweight, weight can be an issue. Having a healthy body weight, eating whole foods, especially fruits and vegetables. Just like the American Heart Association, the American Cancer Society also advocates for having 5 fruits and vegetables every day. That helps to reduce risks of certain types of cancer. By getting lots of sleep, being active, exercising, they're all very important to having a healthy lifestyle, minimizing the use of alcohol, not smoking. We know for sure with the elimination of tobacco products can dramatically reduce certain types of cancers.
And we talked a little bit about the importance of the mammogram. Can you just take me through the importance of screening?
The importance of screening is really, from what I've seen in my practice, is a matter of life and death. By able to get your mammogram early, we can pick up cancers in a very early stage, in a stage 1. If a woman's getting her mammogram every year, we're able to actually track any changes that happen. And if we can pick up that cancer early, the treatment for the woman is most likely going to be much easier. It could be a simple a lumpectomy and radiation. When it's further along, if it's in the lymph nodes, if it's spread anywhere else, we're now definitely involving chemotherapy, hormonal therapy, maybe more advanced surgery. So being able to diagnose cancer early, especially breast cancer, it's a matter of life and death for some women. There are certain breast cancers that are more aggressive than others. Some grow slower, some grow very aggressively.
And there are certain people that I've heard who have elected, because they have a certain gene, to get a mastectomy or a double mastectomy. Can you talk to me a little bit about that?
The BRCA mutation, some people call it BRCA, BRCA mutation. It's a mutation that is actually not as common as people think, because it is on the media. We have celebrities who have tested positive and have had prophylactic surgery. The gene mutation tells us that that person has a very high risk of developing breast and ovarian cancer over time. It's usually over 70% lifetime risk of developing either one of those cancers or both of those cancers. So in order to be proactive, women choose to have bilateral mastectomies and also possibly the removal of both ovaries to prevent those two types of cancers.
And you've mentioned the word early a few times. How early is early enough to have the mammogram?
The current guidelines have started at the age of 40, every year after the age of 40. The American Cancer Society has recently changed those guidelines. For the medical community and for people who are involved in oncology, the Oncology Nursing Society, different physician societies don't necessarily agree with the changing of those, and it's starting at 45. And it's sort of leaving it up to the patient and the person if they want to get a mammogram between the age of 40 and 45, and that it doesn't have to be yearly. They're supporting starting it at the age of 45, and then after, as you get older, then you would go to every other year.
Okay, thank you so much, Christina. We're going to be right back with more of Christina Hunter's information about breast health when we return with Embrace Life. So glad you're with us. Embrace Life is back, and so is Christina Hunter, nurse navigator from Lourdes Health System. So I was wondering about the whole diagnosis of breast cancer. Once a person actually goes through the stages of experiencing cancer, what is it like as a nurse navigator to help them kind of reacclimate, I guess, to life after cancer?
Well, with all patients, we create a survivorship plan, meaning that they need to spend the rest of their life having surveillance, whether that's certain scans every year, every so many months, making sure that they're following up. But at that point, also helping them to start to live their life again and to look forward to living, maintaining a healthy lifestyle. Again, like we mentioned, with good nutrition, keeping active, reaching out to support groups. Perhaps sometimes that's even the best time, is after you've been through it, you're better able to talk about it. And I think that's where some women in particular need extra help, because of the fear of, is my cancer going to come back? Am I really cured? Am I really able to move forward? So connecting with other women that have been through it, I think, is very helpful. Finding hobbies, doing things that all of a sudden you love. Because going through that, people, they look at life a little bit differently and start to appreciate things maybe that they had taken for granted and want to do more with their life. Sometimes it's giving back, sometimes it's connecting with a new group or new hobbies, just focusing on wellness.
And you help them with that?
Yes.
That's an amazing service that Lourdes provides. And I'm thinking about if you are going through the reacclimation after you've experienced a cancer diagnosis, and then you may want to have reconstructive surgery. Is that something that you have during the cancer diagnosis, or is that something that you do afterwards?
That's usually during the cancer diagnosis at the time of surgery. That will be discussed. Right in the beginning, we give women all their options of what surgeries are available to them. Would it be a lumpectomy? Would it be mastectomy? Would it be with or without reconstruction? And there's different types of reconstruction. So it all really depends on what the interest of the patient.
And I was having a conversation with a friend of mine who actually was diagnosed with cancer and went through the reconstructive surgery. And she said there's so many options out there for women to make them feel really, I guess for lack of a better word, normal, that
as natural as,
natural, that they didn't have the mastectomy or something like that. Can you share with us what those are, those options?
There's different reconstruction. You have the implants. They also have a nipple tattooing because many times the nipple has to actually be removed, so it would just be skin. So there's tattooing that looks very, very natural. So that's actually a growing art. And different types of
I guess reduction and enlargement of breasts as well?
Depending on what the woman's actual bra size is to begin with. Can they use implants? Do they need a more advanced surgery where they would actually take fat from the abdominal area and put it up to the breast? And at that time, yes, they can decide, do I want to reduce my breast size? Do I want to increase my breast size? It's all a very individual choice. And what the options are, not only are they meeting with a surgeon, they're meeting with a plastic surgeon as well, who specializes in providing this type of cosmesis for patients.
And then I'm sure with radiology or radiation, the hair loss is an issue as well. So.
Actually, it's the chemotherapy that causes hair loss, which is a huge change for women to go through. Because just like Dr. Greatrex was saying, being a woman, breasts are part of our identity and who we are. But as women, also our hair says a lot about who we are.
Right.
So that a lot of women tend to struggle with the hair loss. It is temporary. We do have the ability to provide patients with wigs, turbans, hats. Some people embrace their baldness. They say, you know what, this is my badge of honor. Like, I'm going to do this. I'm going to kick cancer's butt, and I want everybody to know it.
Awesome. Thank you so much, Christina, for being on the show. It was a pleasure to have you, and thank you for all the work that you do with Lourdes. It's really a pleasure. Thank you so much for joining us today on Embrace Life with Renee. Special thanks to my wonderful guests, Dr. Kathleen Greatrex and Nurse Navigator Christina Hunter, both from Lourdes Health System. Thank you also to Lourdes Health System for your belief in my project and your sponsorship, and I am so appreciative of you and also to my audience. I hope today's show will inspire you and the women in your life to schedule their mammogram. Remember, early detection could save your life, and in the meantime, reach for the stars, dream big, and embrace life. See you next time.